Hi guys, it's Dr. Cosby again, going through another component of the faith integration series into evidence-based practice. The topic for today is knowing and doing, and are they the same? I would provide an argument for the fact that they are not the same, that in fact I believe knowing is a very passive process, and doing is very active. But when you couple the two, knowing and doing, what you could get is something profound, right? Something that could change who you are, could change your clinical practice, could change your patient or career outcomes, right? And so knowing and doing really truly are going to shape who you are as a person and who you become as a professional. And so as I prepared for this faith integration lecture, I was really called to 1 John chapter 2 verses 5 through 8. So we'll kind of integrate that throughout this online mini lecture. So as I was preparing to figure out how to integrate knowing and doing and faith components, I came across this plan, do, check, act checklist, and it really caught my eye. I had never heard of it before, but it is something that can apply both personally and also professionally as you move into your chosen vocation. And so the plan piece of the plan, do, check, act is really just that you basically have to recognize an opportunity and then you plan some form of change, right? And so that change again could be personally or it could be professionally, depending on, right? So you want to change patient outcomes, you want to change your treatment paradigm or your rehab paradigm, right? You have a plan. And so the do portion of the plan, do, check, act cycle is the idea that you're going to test that change, right? So that might look something like carrying out a small scale study, which some of you guys are going to do with your COMPS projects if you're doing a COMPS or a capstone project, right? And some of you might also do this with a small scale thesis study as well. The check component is when you actually review the test, right? So you're either going to analyze the results of that capstone project or that thesis project, and then you're really in this piece, you're going to sit back and you're going to reflect and you're going to say, what have you learned from this process, right? And so in evidence-based practice, what that means is, okay, based on the results, how am I going to then take action based on what I've learned from that particular study, right? And so that's the act piece. And so we can see how, yes, the plan, the do, the checking, and the acting really plays into what you guys are living right now in this Master's of Science in Kinesiology, right? You're planning either a project or you're preparing for your written COMPS exam. You're going to collect or analyze data that would really be applicable to either a patient population or a client population that you want to work with. And then you're going to check those results, and based on the results, you're going to act. But how does the plan, do, check, act cycle also apply to your life personally, right? And so I would say, in my life, one of the things that, I personally need to work on is balancing life, right? And so how can I create a plan that is going to allow me to be successful in balancing my life? How can I test that plan out? And then again, once I get to the check piece, well, how are my grades up to date? Is my husband and are my kids happy? And then based on the results, right, then I can figure out, okay, if it didn't work, if my grades aren't great, or if my grades aren't up to date, if my kiddos aren't happy because I'm not home enough, what can I do in my life to change this? And then guess what? It's cyclical. I have to keep planning. I have to keep doing. I have to keep checking and acting until I find a way to reach homeostasis or balance. And so the plan, do, check, act, again, it's something that can apply to your vocation, but it's also something that can apply to your personal life as well. And so how does the plan, do, check, act cycle and the evidence-based medicine cycle go hand in hand? Well, when we think about the two, right? When we think about evidence-based medicine, it's a cyclical process. It's something that never truly stops if you're an evidence-based practitioner, right? And so what that means is we start with asking the question. We're going to do the literature search, right? And after we do the literature search, we're going to critically appraise that literature. And based on the literature, what we're going to say is, this is something that I can take away and I can use in my clinical practice, or I can implement it in my clinical practice. And then after I've implemented it, right, the next step would be to what? Reevaluate whether or not that change was beneficial to either my patients or my clientele. And so we can see how the Plan, Do, Check Act and the process, the cyclical process of evidence-based practice kind of go hand in hand. And so as I was sitting in a faculty meeting, you know, our provost, Kerry Fulcher, he began to read what is in the red. And what he said is, knowing and doing are at the core of every examined life. So that's everybody, right? But putting the two together is the most difficult challenge you will face. And so I kind of put this young lady here on the screen for a reason, because right now you guys are probably in the midst of craziness right now, right? You're getting ready to propose your research methods projects this week. You're getting ready to enter into evidence-based practice. You're getting ready to start either your capstone project or your thesis project. And so life is just crazy, right? And so you'll have piles of research articles, and maybe your apartment or your house or your dorm room looks exactly like this, where you're kind of weeding through the evidence and you're trying to figure out which of the evidence on the floor really would help you answer your clinical practice. So keep in mind that knowing and doing are at the core of everything that every exam in life, but it becomes important that you put the two together, right? Because again, knowing is very passive. And I think about the student who sits in class and the professor asks a question of the class, but that student knows the answer but never ever responds, right? So that would be a passive knower. And then the doer is the person who really, really is an active individual. They want to see change in patient outcomes. They want to see changes in their clinical practice. And so they take their knowledge and they seek, or they're active in changing their clinical practice. And so I leave you with this because this is what I was left with in faculty meeting. It was, as always, the way that belief and behavior are formed over time is complex, right? But it is clear that the way that we live shows what you or what we believe, right? And so that I challenge you, or I encourage you, as you're living out this year of your life, and as you leave this place, that you really keep in mind that it might not be anything that you're saying. It could be everything that you're doing. It could be body language. It would all be a representative of your relationship with God, right? And so just be very cognizant of that. And so in 1 John, I was really called to this because in 1 John, specifically on verse 5, he talks about this idea that if anyone obeys his word, love for God is truly made complete in them. This is how we know we are in him. Whoever claims to live in him must live as Jesus did, right? And so this isn't saying that, Jesus didn't always walk around professing the word of God, but the way that he lived his life, his confidence, the interactions that he had with people, sometimes that was more than enough for people to know that he had this amazing relationship with God. And so as you go into your clinical practices, as you start your preceptorships or your practicum classes, I really just want to encourage you to be evidence-based practitioners, but to also remember that it is clear that the way we live life, the way we live shows what we believe. And so in every patient interaction, always be cognizant of that. Be cognizant of the fact that you are a representative of not only Point Loma Nazarene University, but also of yourself. Thank you for listening to this 10-minute devotional. I hope that it was helpful. Looking forward to moving into module 4 with you guys, which is critical appraisal.